Apparently we are live and ready to go with our course, a 3-day training course on vector surveillance. Very good day to you, good colleagues from all across the world, and a warm welcome to each of you. Thank you for joining our APMEN online vector surveillance course, which I have absolutely no doubt you're going to enjoy and you're going to learn a great deal. This online course is another of the range of capacity strengthening initiatives organized by APMEN in support of malaria elimination. I think many of you already know that APMEN stands for the Asia Pacific Malaria Elimination Network, but our courses are as relevant in South America or Africa as they are in Asia. So welcome aboard wherever you are from. And again, thank you for joining. We're fortunate indeed to have as our course trainer someone who I firmly believe is the top world expert in the theory and practice of vector surveillance. And that person is Professor Neil Lobo. Neil is not a couch academic, I can assure you. He's deeply involved in a very hands-on way with vector control projects across the world, with very deep experience supporting national malaria control programs, and he has a wonderful way of sharing his experience. But before I introduce Neil to you, let me say something about the online training, how it's going to work. The sessions are all being recorded, by the way, and it will be available on the APMEN website if you want to go back to the lessons or invite your friends to share in this course. Our course will be over 3 days, today until Thursday, for between 2 to 3 hours per day, and we'll have a 10-minute comfort break midway through each afternoon. Certificates of attendance will be issued to all people, listen to this clearly now, to all people who attend each of the 3 days for at least 75% of each day. So you have to link in every day for at least 75% of each day to qualify for receiving a certificate of attendance. And that participation or attendance is based on computer system records of attendance. During the training sessions each day, please feel free to post questions and requests for clarification, but please put them in the Q&A box, not the chat box, please. I should mention there are probably more than 1,000 of you listening into this course today. Dr. Poen informed us that there were this morning 2,508 people who registered for this course. It's absolutely mind-boggling. But you'll understand with that number of people participating, we cannot monitor the Q&A box as well as the chat box. So please only use the Q&A box for your questions. Thanks for that. So let me introduce Neil, who's going to lead us through this course. Professor Neil Lobo is with the University of Notre Dame in the USA, and also associated with the Malaria Elimination Initiative at University of California, San Francisco. Neil's research and government support takes him to malaria endemic countries all over the world, and his primary interest is to clarify how the various aspects of malaria transmission interact, integrating vector bionomics, social behavior, environmental factors, and others to better understand the root causes of persisting transmission and improve protection on a granular local level. I should also mention that Neil is the person who developed the very comprehensive entomological surveillance planning tool known by many as the ESPT. And much of what he's going to be talking to us about is captured in this ESPT. And he will tell you how to access that ESPT course. And that course is now being used in many countries around the world. So I can guarantee that by the end of this course, you will agree that Neil is a highly knowledgeable, person about vector surveillance. And on top of that, he's a very nice guy. You will get to like him for sure. Before we start the course, I'd like to ask your help, big please, to measure the increase in your knowledge over the duration of the course. We'd like to ask if each of you could do a short vector surveillance knowledge test at the start and at the end, now and then on day 3 at the end. You're not going to fail if you score poorly. Don't worry. And your score will not be open for others to see. You won't be penalized. We just want to see how your knowledge has improved over the 3 days. So please may we ask your patients to fill in this online questionnaire. I'm going to ask our colleague Wu Lan to explain how to access this online questionnaire and how to fill it in. You'll have 20 minutes to fill in this questionnaire, and then directly after that, we'll start the course. I want to ask you a favor as well. Please do not use Google to search for an answer to um, guide you to fill in this questionnaire. It's a simple, easy, multiple choice tick box type questionnaire. Straightforward, easy. If you use Google, that's not going to help us understand how effective this training course has been to improve your knowledge. We need to know your
Yeah,
real knowledge. So please just use your own brain. Wulan, can I ask you to take over, please?
sure. Thank you, Dr. Leo. So to all participants, thank you for joining on day 1 course of vector surveillance with Professor Neil Lobo. We have pre-test questions for you to respond to before we start the presentations. So you have 20 minutes to complete it. So please use the same email address for pre-test and post-test, so we can track individuals' progress for the test. Post-test will be done on the last day of the training. So we will have pre and post-test in the first day and the last day of training. Then you can also find the pre-test link in the chat box. So I turn off chat box function for the moment. So I think you can find the link in the chat box. Please let us know if you can't see it. I will copy again the link for you. Thank you. So you have 20 minutes, start from now.
Wulan, you say you're going to put the link in the chat box, eh? Just to make that clear.
Yes, yes.
Yeah,
I think everyone can
it.
see the link.
No, I cannot see the link, Wulan.
Okay, so this is
Was it
pre-test.
copied to everyone or just
Yes, I copy it to everyone.
Okay, perfect.
Okay, I see it there in the chat box.
Correct, yes.
So
You
please
might have, yeah.
stop
Go.
sending message in the chat box so that everyone can see the link. Thank you so much.
Okay, we're going to stop talking now for the next 20 minutes so we don't distract you. So please focus on the pre-test, and we wish you luck. See you in 19 minutes' time. Okay, we're going to start again in 1 minute's time. So try and wrap up your questions if you don't mind. Starting in 20 seconds. Okay, so thank you so much, everyone. Very, very grateful for your patience and your willingness to complete this pre-course questionnaire. It's really helpful for us, and it enables us to give feedback to the donor as well, to show the value of the course in improving general knowledge about vector surveillance. So thank you. I know that several of you had problems accessing, activating the questionnaire. Sincere apologies for that. There's a glitch there somewhere for some of you, but overwhelmingly, based on the thumbs up signs that kept coming up on screen, most of you were able to link in successfully. So the sample size will be strong enough to get some indication of average knowledge and the spread of scoring. So thank you for that. So what we're going to do now, without further ado, I'm going to hand over to Neil, but just so you know, we'll have a 45-minute session of training by Neil. Then we'll have a 10-minute break, and then we'll have a 60-minute session of training again, followed by a 20-minute questions and answers session. So 45 minutes, 10 minutes, 60 minutes, 20 minutes. Neil, over to you, please.
Hey everyone, good morning, good afternoon, good evening, wherever you are. I am in Uganda right now, so good morning. Thank you, Leo, Wulan, and Phone. I hope today, tomorrow, and the day after go well. Just as a note, so I have multiple presentations, and what I'll be doing is going through one and then closing it up and starting the next one. So you might have to be patient with me while I switch between presentations. I'm going to start now. Let's not waste any time. So while I start my first presentation, share my screen, uh, share. I hope you can see that. Not yet. Hold on. Share. And there we go. So my first presentation is on the importance and relevance of entomology or entomological surveillance in public health. Along with this, I'm going to go through a couple of key concepts that I hope you sort of ingrain in the back of your head so that whenever you're working with entomology or entomological surveillance and malaria, that you remember these key concepts. And by the way, this first slide is the favorite slide I've ever made, and the video is of Anopheles stevensi, and this was made by the Bill and Melinda Gates Foundation. Now, first slide. Okay, I'm sure most of you have seen this slide. What is the world's deadliest animal? And the world's deadliest animal is the mosquito, followed by the second most dangerous animal, which is the human. Humans kill more human beings after mosquitoes than anything else on the planet, which is sort of sad. But anyway, the mosquitoes are most dangerous and they kill human beings through multiple diseases. Now, when we look at vector control, and the primary reason we would want to do entomological surveillance is to understand how to combat the most dangerous animal on the planet, which is mosquitoes. And why are vector control interventions so important? And this is sort of a key thing. Why are we focusing on this? So there was a modeling study done in 2015 by Butt et al. And you can see the reference at the bottom of the slide here. And this demonstrated that interventions, vector control interventions, have averted, well, including human interventions, as in treatment with drugs, have averted about 663 million clinical cases since 2000. And bed nets, the vector control intervention, has averted the largest number of cases of all the intervention, and that's about 68% of cases. And on the left in the figure, you can see a country on the left in 2000, and on the right, the same country, the line joining the reduction in cases. So, for example, right on top, you see Burkina Faso, the number of cases in 2000, and how it has dropped by 2015. And vector control, or bed nets, are the primary cause of this, which is actually kind of phenomenal. So this brings the question, so why are these adult vector control interventions so successful? And since there are so many participants, I think phone told us that there were about 2,400 or 2,500 registrants. Normally, I prefer to be very interactive, but with this many people, I doubt I can be interactive. So you're going to have to listen to me just talk. So why are these interventions so successful? And normally I'd ask you to give me reasons. And very interestingly, it's about mosquito age. So if you step back for a second and sort of understand a few things, you might already know this, so please be patient. But the survival rate of mosquitoes is about 77% to 84% every day. So every day, about 80% of mosquitoes survive from the previous day. That's one thing. The second thing is Plasmodium, the parasite that causes malaria, takes about 10 to 14 days to mature in mosquitoes, right? 10 to 14 days to become infectious in mosquitoes. So the mosquito is only infectious to humans 10 to 14 days after getting infected with malaria, right? So for 10 to 14 days, it cannot transmit malaria. Only after that can it give humans malaria. So old mosquitoes are more infectious. That's an important concept. Old mosquitoes are more infectious. So now let's look at this, right? So if you look at the survival rate as being 80%, on the left axis and the y-axis is the number of mosquitoes. So let's say we have 1,000 mosquitoes. And on the x-axis, it's day 1, 2, 3, 4, all the way until day 22. So if we start off with 1,000 mosquitoes on day 1, on day 2, we'll have only 80% of those. So that's about 800 mosquitoes. On day 3, we'd have 80% of those. And so every day...
And Neil, I'm very sorry.
Yeah.
Can I interrupt briefly?
Of course.
Sorry, yeah. So Wulan, Dr. Porn, I'm asking your advice here. A number of the participants say that they can't see the slides that Neil is projecting. Can you think of a quick, obvious reason for that and how they can solve that problem?
I think it might be internet connection from their side, or maybe they can also choose this tab. Just Prof Neil logo screen. So make sure that you choose this tab, that tab, not the tab.
Where's
But you
that
can see
tab,
her
Wulan?
screen.
Where is the tab?
So you will see two tabs. The one with webinar, another one is Prof Neil logo screen.
Ah, okay. So on top, it's the bar on top of your screen. You'll see starting at the extreme left, Zoom Workplace, then Webinar, and approaching the middle of the screen at the extreme top is Prof. Neil Lobo's screen. Please tap that, click on that bar, and it should open a Neil's screen. Neil, I'm very sorry to interrupt you. Please continue.
Oh, no, not at all. And everyone, as a note, I am absolutely fine with interruptions. And if you need to see the slides, please mention it, because that is also very important. So I'm absolutely fine with interruptions. Interrupt, ask questions at any point of time. So back to the slide. I hope you can see them now. So when we look at a survival rate of 80%, and on the y-axis on the left, we have 1,000 mosquitoes. And on day one, we have 1,000 mosquitoes. So on day two, we'd have 80% of those, which is about 800. Day three, we'd have 80% of those. Day four, we'd have 80% of the mosquitoes on the previous day. And so you can see in the blue the number of mosquitoes that would happen over the course of 22 days from 1,000 mosquitoes on day one, correct? Now let's suppose that on day two, every single mosquito gets infected with malaria. Let's imagine that every single mosquito bites me and I have malaria and they all get infected with malaria. This means that in 10 to 14 days, they will actually be infectious because that's the time it takes for the Plasmodium parasite to develop in them. So they are only infectious after that. So every single one of these mosquitoes can bite every single one of you every single day for those first 10 to 12 days, 10 to 14 days, and none of you will get malaria, even though there is malaria in all those mosquitoes. And only after that, in the red, are those mosquitoes infectious. So with a daily survival rate of 80%, we start overall every day we have about 5,000 mosquitoes. This is 4,963. But at the end of it, after day, let's say day 12, only about 392 can be infectious, which is about 8% of them, right? And this is with an 80% survival rate. Now imagine we have an intervention, let's say bed nets, let's say IRS, let's say anything. And that intervention decreases the daily survival rate by 15%, from 80% to 65%. Now let's look at the curve of mosquito survival on the left in green. Now you can see every day there'd be only 65% of those mosquitoes remaining from the previous day, and you can see the curve. Now, this reduction in 15% from 80 to 65% has a huge impact on the little red proportion on the infectious mosquitoes. Even though the survival rate was reduced 15%, the number of potentially infectious mosquitoes gets reduced 10 times. Correct? And that's because the proportion of older mosquitoes is hugely reduced. 10 times. It's not 15%, it's 10 times more. And that is the primary reason why increasing the daily death rate or decreasing the daily survival, you will have a huge impact on older mosquitoes and therefore a huge impact on potentially infectious mosquitoes and a huge impact on malaria. And here's something interesting. Let's say you have a daily survival rate of 50%, a really good intervention. You will have almost no infectious mosquitoes. Can you see this? The light blue at the bottom? Only 0.05% of them. So you can have a huge number of mosquitoes flying around, and almost none of them can give you malaria. And that is why adult vector control interventions are so impactful. Now, what about larval interventions, immature larval interventions? They function slightly differently. And this is also important to understand. So here is adult survival rate of 80%. And let's say larviciding has an impact of 50%. This is just an assumption. We can have various numbers. So we start off instead of 1,000 mosquitoes, because larvae impacts the number of adult mosquitoes, we will then have only 500 mosquitoes starting as adults. And this is the checkerboard pattern. You can see there's no impact on adult survival because larviciding only impacts the larvae. And you can see that the proportion of infectious mosquitoes remains the same at about 8%, but the number of infection mosquitoes gets reduced, but the proportion impact larviciding have, which is 50%. So the number of infectious mosquitoes goes down by half, but not 10 times like with adult interventions. I hope that made sense. So now if we sort of superimpose everything, we can look at the proportional impact an adult intervention has versus a larval intervention. And that is why adult interventions have a much greater impact on the infectious number of mosquitoes than larviciding or larval interventions, even though they do have an impact. So this is sort of principle number one, how mosquito interventions, vector control interventions impact disease transmission. And as a note, this is also applicable to other diseases, not just malaria. If you understand how long it takes a mosquito to be infectious with dengue, you can also apply similar principles to other to other diseases. As a note, all the principles we will be going over, all the sort of lessons we go over with this training course is applicable to other diseases, not just mosquito diseases, to sandflies, to other things. So if you take them and adapt them to based on how those vectors function, you can have an absolutely valid intervention or surveillance plan. So the second sort of principle is that transmission, with malaria at least, is sustained by two parasite reservoirs. One parasite reservoir is in the mosquitoes. There are mosquitoes infected with parasites flying around. And the other parasite reservoir is in humans. There are humans with malaria, well, not flying around, but, walking, sitting, sleeping around. And vector interventions prevent mosquitoes transmitting parasites to humans. And human interventions like treatment with drugs or MDA or diagnosis and treatment, right, prevent transmission to vectors. So each intervention functions differently, as in it prevents transmission in a specific direction, either to humans or to vectors. And this is why, if we have only human interventions, or if we have only mosquito interventions, we are realistically not going to get rid of malaria. And the reason is because there's another reservoir supplying the transmission system with parasites, right? Only until we get really, really, really low transmission can one intervention or interventions in one direction help prevent malaria. But usually we'd want transmission to be prevented in both directions. And this can be accomplished in two ways. Conventional campaign strategies, and this is top-down Ministry of Health, for example, Ministry of Health transmission, Ministry of Health strategies, such as treatment with ACTs or Primaquine, screen and treat, IPTI or IPTP. All these interventions prevent transmission to vectors, while bed nets or IRS or LSM prevents transmission to the human reservoir. Complementary to this, and I would actually suggest people look at this, especially in ministries of health, supplementary community-based strategies is strategies from the community where you can do active case detection, or very importantly, community education, or SBCC, social behavior change communication, engagement of leaders, not just in villages, but also religious leaders and things like that. It's a huge impact. Community can have a huge impact on larval source management because they know their areas, they know where their larval sites are. Education on specific interventions, all these can hugely impact how interventions can impact malaria and how effective they are. And there's a saying that someone told me once that sort of has stuck in my head. Nothing is more powerful than a mother trying to protect her child. And that is the sort of the basis of community-based strategies. Even though we might have really good top-down Ministry of Health strategies, if you have your mother, an educated family protecting themselves in a way that is so much more powerful, and you can use that power from the mother, from the family, to utilize conventional campaign strategies and maximize the potential impact. So to me, at least in my experience, community participation and education is vital for a sustainable malaria elimination strategy. And that's something to keep at the back of your mind, especially when you're working in a Ministry of Health. The next principle, I hope this is useful because this actually completely changed how I look at malaria transmission years ago. So it's called the Bayer curve, and the references below. So on the y-axis, we have malaria prevalence, the proportion of the population that actually has malaria. So for example, over here right now, 80% means 80% of your population at a specific time has malaria. On the x-axis is the annual EIR, which is the entomological inoculation rate. And this is the number of infectious bites a person receives in a year. So, for example, if the EIR, the annual EIR is 6, that means if I'm living in that area, I get 6 infectious malaria bites, infectious mosquito bites a year, which means I am infected 6 times a year. And now I know you're looking at these numbers and thinking 450 infectious bites a year? That's a lot. And very weirdly, that is very real. There are sites around the planet where people get 150 to 600 infectious bites a year. And you can imagine, no matter what you do, that person is getting continuously infected with malaria. And that is true in a lot of places with high malaria transmission. So, for example, if you have 600 infectious bites per year, what data demonstrates is that about 90% of the population has malaria at that point in time. So now let's say you're in the Ministry of Health and you have an intervention strategy and you do a really good job with your strategy and you reduce your EIR from 600 to 300, which is a reduction of 50%. You've had a huge impact on the transmission system. But what actually happens is your transmission, your prevalence, actually gets reduced just by 5%, even though you've done a phenomenal job. Correct? Now, let's say you do that even double. You have a 4 times impact on the EIR. It gets reduced to just about 78%. Of course, these are approximate numbers. So you've actually had a giant impact on transmission, but your malaria doesn't go down that much. And this is what we see in a lot of places. And this is because you have those 2 reservoirs, right? Sustaining transmission from both directions. And you're having a huge impact on one reservoir, perhaps, but the other reservoir is compensating, right? In a previous slide, we went over that. But there is a point in time when you can have an impact on transmission, where you can see that transmission drop. And in a lot of places around the world, what we see is huge impacts on disease, on the transmission, but not a huge impact on malaria prevalence. And this might be the case in areas like Papua New Guinea or areas with really high transmission like Nigeria. And of course, we need data to demonstrate that. But this might be the case because the Ministry of Health might be doing really good jobs and reducing transmission hugely, but not having the intended impact on malaria prevalence. And what we need to do is have a concerted strategy where we attack both reservoirs simultaneously in a really good manner to get the transmission down to this orange level and get transmission down where we can actually see a drop in malaria, where we can have an impact, a sustained impact in transmission. So we'll do a quick gear change. I hope that made sense because that actually changed my mind about how I see transmission and how to evaluate transmission and evaluate malaria interventions. So that leads us into mosquito behaviors and interventions. How does mosquito behavior impact interventions and how efficacious they are? Now, here's a little cartoon of a site, and you can see there are lots of little orange mosquitoes flying around, probably far too much for any of our liking. And let's imagine at this site we have 3 mosquito species. Species 1 likes to feed outdoors in the blue. You can kind of see that in blue. Species 2 feeds both inside and outside, while species 3 feeds inside. And really, we see this at a lot of sites, and I'll go over this in other slides. We see this in many areas where different mosquito species have different behaviors, and they feed on humans in different areas and at different times. Now, how do interventions work? Interventions take advantage of susceptible or specific mosquito behaviors. Now, when we look at bed nets, now ask yourself, how are bed nets effective? Now, bed nets take advantage of human and indoor biting mosquitoes. If your mosquito bites outdoors, it's not going to be effective. If your mosquito likes biting cows and not humans, your bed nets are not going to be effective. Correct? IRS, or indoor residual spraying. How does indoor residual spraying work? Indoor residual spraying works on indoor resting mosquitoes. If mosquitoes don't rest indoors, they're not going to be affected. If mosquitoes fly indoors, bite human beings, and leave and go outdoors without resting on sprayed walls, IRS is not going to be that effective. So now let's take these 2 interventions and place them at our imaginary site. So that's where we place IRS and bed nets. Now, when we look at the figure in this manner, what is not covered by the black IRS and BedNet square? Everything, right? Almost everything. So we can see that these indoor interventions will impact species 3 the most, species 2 slightly less, and probably won't impact species 1 much whatsoever. So these other species that are not impacted are the ones that sustain and carry on transmission. So, and this is a gap in protection is where there's a place or time where a human being is not protected, no matter how you look at it, right? So vector control interventions target specific mosquito behaviors, right? And interventions protect humans from mosquito bites when human behavior and the vector behavior is targeted by that intervention overlap. So we can see in the green in the middle is where you're going to get transmission, where humans and vectors overlap. And if we put an intervention over it, let's say bed nets that work indoors and late at night when humans are underneath them, right? We will get protection in that space where all 3 overlap. And in the space where the intervention cannot protect humans, for example, outdoor biting with bed nets, or indoors before people go to sleep with bed nets, before they go under their bed nets, you will have a gap in protection. And this gap in protection is where we continue to see malaria, where we continue to have infections. And this is really important because so many places, countries, intervention strategies measure the protections. I have heard so many times, and people who have heard me talk before will probably have heard me say this before. It is so great that you have 80% bednet coverage and 80% bednet usage. But I want to know why you still have so much malaria, right? It's important to see how well we protect people, but it's more important to see how our strategy does not work. Where is the gap in protection? How does my intervention not work? Because that is where all the malaria is coming from. And a lot of these next 3 days is focused on trying to identify how to protect people, how our protections are happening, as well as how our protections are not happening, where are people continually being exposed. And to me, this is how we can actually increase our protections and further protect people towards malaria elimination. So now when we look at behaviors and interventions, uh, I just lost my train of thought. So I hope, perfect. I think I know where I am right now. When we look at behaviors and interventions, it's really important to understand that when we put pressure on a system, like imagine when you push down on a blown up balloon, it pushes back, correct? And over here with malaria has been around far longer than humans. Malaria was there before humans were around on this planet. The malaria infected like multiple species before humans were around. So we are basically battling evolution, right? And evolution's pretty strong. When we push against a system, it's going to push back. So when we push against this little system in the little diagram, it's going to push back. And let's see the ways in which it can push back. So when we have an intervention, in this figure, we looked at one specific vector. Now let's say we have multiple vectors, vector A, vector B, and vector C. So vector A, let's say, is completely encompassed by the intervention. It is indoor, human biting, and late night biting. And we put in bed nets, which means bed nets are going to impact it really, really well. Vector B bites indoors and outdoors. Let's say half of them bite in the middle of the night, half of them bite in the evening. And so it's partially impacted. And vector C bites only outdoors. And I'm using bed nets as an example here. Now you can imagine that each of these 3 vectors are impacted differently. And understanding how this is happening at your site will let you know how your specific intervention is impacting each of these vectors, whether it's bed nets or IRS or spatial repellents or anything. Now, what happens when you have this intervention in place? with these three species. The first thing is that vector A is going to be impacted hugely. So its composition might reduce, or it might even disappear proportionally because it's being impacted the most. Vector B might reduce as well. Correct? And you'd want to be able to monitor for those changes. This is where entomological surveillance comes in, right? You'd want to make sure your intervention is actually working. And what happens with vector C? It probably won't be impacted. So when you put in an intervention like this into a system like this, if you understand the baseline behaviors and what's happening with your system, you can actually understand how your intervention will impact the system. And now you can monitor the changes over time because you're already expecting these changes to happen. So if you have this knowledge before you put an intervention in, you can actually see how impactful it actually is. Now, the second thing might happen is that your vectors, again, remember you put pressure on a system, it's going to push back. And let's say we're looking at indoor residual spraying. So your mosquitoes are resting inside on sprayed walls. Now, mosquitoes are not going to want to die. We have evolution to contend with. So your mosquitoes might start changing their behaviors. And we've seen this at some sites with bed nets. Mosquitoes start biting outdoors. With IRS, mosquitoes start resting outdoors instead of resting indoors. And what happens is your mosquito changes its behavior and it's less impacted. This is also something you can characterize and track over time with entomological surveillance. And of course, with insecticide resistance is the third thing that might happen. And you can see that as insecticide resistance develops, your vector becomes less impacted by your intervention. And then what might even happen is population might grow even more, right? Because it's not being impacted by your intervention whatsoever. So the three things that might happen with an intervention is a change in species composition, change in mosquito behaviors, as well as the rise and spread of insecticide resistance. And to me, these three things are so important to monitor over time with any intervention. And most of the time, countries are already doing this. They don't just look at it with this sort of perspective. And we will go over this in later slides. So malaria transmission is determined by local vector species. Different species have different behaviors, which is really irritating because I wish they had the same behavior. We could just deal with all of them at once. And species-specific behaviors and compositions at your site will determine how efficacious a sampling method is. And so again, every mosquito has different behaviors. So different sampling methods, such as HLCs or CDC light traps, etc., will function differently with different species. And I'll go over this in another presentation. Species-specific behaviors will tell you where and when transmission is happening alongside human behaviors, and I'll describe that in another presentation. And species-specific behaviors will also tell you the potential of an intervention. If your mosquitoes are resting on walls indoors, IRS might be effective. And you can also evaluate an intervention based on species-specific behaviors. So to summarize this, the importance of entomological surveillance, it can function as the intervention. And I cannot stress this enough because it will tell you what interventions to put in, what interventions might work, what interventions will not work, how they are not working, how they will never work, where your transmission is coming from. It'll tell you the drivers of transmission, how to select an intervention, how to evaluate an intervention. And once you implement an intervention, entomological surveillance will tell you how to optimize the intervention. And I can go over that on another presentation as well. It'll tell you how the intervention is not working, gaps in protection, for example, and also changes in the transmission cycle, transmission system, and will tell you how to respond to it. So overall, a very well designed entomological surveillance system, which almost every country is doing already, can function as the intervention. So that is the end of my first presentation. I hope that was useful. I'm going to quickly switch out slides to my next presentation and get a 30-second breather from talking. So hold on 1 second while I switch my presentation. And here we go. So as Leo mentioned at the beginning, me and MEI, the Malaria Elimination Initiative at UCSF, together we designed the entomological surveillance planning tool, which sort of incorporates all these concepts. And we have been using this as a guideline for entomological surveillance planning. So I thought it might be good to just go over this briefly. And there's all this reference material and everything already available, so you can download it at any time. So I'm going to spend a few minutes just going over this so you can see the background to it and where you can access everything. And then I'll start off on my presentations on entomological surveillance. So what is the ESPT? It is a decision support tool. It helps you plan entomological surveillance. It helps you interpret the data you gather, and it's all directed at programmatic vector control decisions. What is the best decision to move forward with? How do we best protect our populations? As a note, even though the ESPT is directed towards ministries of health and implementation science, I use this all the time in academic study designs. So I'm a professor, I'm an academic, and so I have all these research studies, and I use the exact same principles to design scientific studies. So just because this ESPT tool is directed to ministries of health and implementation, you can use this to direct you can direct this at your scientific designs and studies as well. It's absolutely applicable, and other diseases, as I mentioned earlier. So the ESPT aligns with WHO and PMI. PMI is not there anymore, unfortunately, but it aligns with all the principle and guidelines from WHO. It is practical, and it is based on being cost-effective, question-based. And I'm going to go over why questions are so important, why it's so important to have question-based entomological surveillance. It also supports the integration of multiple types of data. A lot of us are so focused on our entomology, we forget about other super important things out there. And it's really sort of interesting to me that a lot of program managers, not everywhere, but a lot of program managers might be physicians and doctors, and a lot of them don't necessarily pay the appropriate amount of attention to entomological data. As I'm sure you know, all us entomologists love our data and think it's so important, but a lot of other people may not. So it's sort of in our own interest to understand these other kinds of data, epidemiological data, climate data, other intervention data, human behavioral data, because it makes us better scientists. It makes us better decision makers. And when we understand entomological data from other perspectives of how and epidemiological data is functioning, the impact of entomology on epidemiology, and vice versa, we become better decision makers, and we can actually present our data better to people who actually make these decisions. So the ESPT is actually available on there's a whole bunch of YouTube videos that you can go over. So aside from the YouTube videos from APMEN, the entire ESPT is on YouTube as well. And you can access this just by actually Googling it. The link is at the bottom. And it is all presented by Mercy Opio, my friend and colleague, who is, you can see a picture of her there. In addition, there is a little ESPT, which is an electronic version of the ESPT, which you can download to your computer and work through it. So it's everything that's on the PDF version of the ESPT. Oops, I forgot to even mention that. So if you Google ESPT and MEI, you will get to the page with all this data on it. And there's a PDF version of the ESPT, which is available in multiple languages. The latest one is in Bahasa, Indonesia, which is, I think, is just a week and a half old. And I want to thank Pak Din Syafruddin and Ibu Puji for helping translate this in Indonesia. So this, and back to the little ESPT, the electronic version, you can actually work through your entomological surveillance plan and go through multiple iterations of it and base it on the amount of funds you have and have multiple outputs and understand every component of it And at the end of it, you can actually download it as a Word file and send your Word file in a report, download pictures, decision trees, and things like that, and present them to your boss and, show them how you thought through this. It goes through every single process that you would have been through. It has all the data and tables on there as well. It's called the little ESPT. I'm saying little ESPT because I don't know how to differentiate between the capital E and the little e. Anyway, so that's also available, which you can download, and it's on my desktop. So the objectives and use cases, the reason for this is, so MPAC, which is the WHO Policy Advisory Committee, said this, and I'm sure you all understand this. Malaria is heterogeneous. Across your country, malaria is different across the country, different amounts of malaria, different species, different climates, everything. And a one size fits all will not work against all these different sort of systemic differences in malaria. So we cannot have a one package and attack malaria. We want to have subnational tailoring, right? So that based on what the transmission system, based on drivers of transmission at different sites, we would want to deploy the most appropriate intervention package. And understanding this is sort of the basis of the entire ESPT, of this entire 3 days of training. So we want to be flexible. So this is especially relevant now with the global decreases in funding for entomology, for malaria. We have less money, we have less resources. So how do we focus our efforts, focus our entomological surveillance, focus our decision making with our limited funds and make the best, what's the best return for our investment, right? So right now, the ESPT, better entomological surveillance, is especially relevant now, considering the reduction in global funding worldwide. So the objectives is to support PMI had, if you've downloaded all their guidance before it was deleted, has really great guidance, but it's not specific to your country. It's not specific to your area. It doesn't tell you how to do, what to do, where. So this enables, ESPT enables you to apply all these principles to your area. It looks at minimal essential indicators. Now, WHO and PI have multiple indicators to look at, but you don't need to collect all. You just need to collect the ones that answer your question. And that saves money, it saves resources, it saves capacity, it saves so much. You don't have to collect a lot of things. And I'm sure you know, if you are in the Ministry of Health, how much data you collect every single year and how much of that data is actually used for decision making. And all the data that's not used is basically wasted. It's sitting on your computer. It's sitting on actually my computer, waiting to be used. So we want to direct our efforts to collect actionable data, data that we can make actions on, decisions on. And as I mentioned, we want to integrate other kinds of data. Who can use the ESPT? This is probably the shortest slide ever. The answer is everyone, for science, for implementation, for anything, and for other diseases as well, if you can apply the principles. So conceptually, the ESPT says that entomological surveillance should be question-based, and I have a whole group of slides on this, so we'll go over that. It's really important to look at mosquito behaviors and how interventions function. And we went over these principles on previous slides, right? Interventions function by taking advantage of mosquito behaviors. Different vector species have different behaviors, right? And all this changes when you put an intervention in. When we put an intervention into place, we immediately change transmission. And we have to remember that, right? If we immediately change transmission, why do we continue doing the same things? We need to adapt as we move forward. So human behaviors impact intervention efficacy, of course. Minimal essential indicators, I talked about that. We want to focus in on exactly what we want to collect to answer our questions. Let's take out all the extra things. We want to factor in metadata and non-entomological sources of data that help us understand things better. And as we mentioned earlier, transmission systems are dynamic. They change. They not just change over seasons, they change potentially with climate change. They change when you put an intervention in. They change when humans change, when land cover changes, when people put in rice fields, everything changes. So we want to ensure that while all these transmission systems are changing, we adapt and we understand what's happening so we can make the best decisions moving forward. Oh, also, funding changes. A very important thing, funding changes, as we've seen recently. So how does the...
Neil, sorry,
Yeah.
before you move on to any new subsection, I suggest maybe we break here for 10
Oh,
minutes.
absolutely.
Is that okay with
Absolutely.
you? Convenient here?
Absolutely.
All right.
Thank you, Leo.
Okay,
We will...
so audience, you've been wonderful participants, posting many questions, making wonderful comments in the chat box. A number of you have raised your hands. Unfortunately, because of the sheer number, there are 990 of you participating at this particular point. Right now, there are 992 of you participating. So we cannot open the floodgates to allow, all the people raising their hands. So very unfortunately, we must ask you please to put your questions. If you have questions, put them in the Q&A box. If you have comments, please put them in the chat box. I'm sorry about that, but it's just a practical reality that we cannot cope with the big numbers. So let's break for 10 minutes and give Neil an opportunity to catch his breath. We all go to the bathroom, get some tea. See you back in 9 minutes' time. Thank you.
And Leo, if I may add, and the break has started, please send in your questions and we will make every effort to answer every single one of them. So even after the session ends, I will spend time going over all of them and send all the responses back to APMEN, to Leo and Wulan and Phone, and they will put up the answers somewhere. So please don't hesitate to answer your questions. We will make every effort to answer every single one of them.
That's very generous of you, Neil. There are many questions coming in. I've harvested a good number already, and I've put that on a Word in a Word document, and I'll screen that at the start of the Q&A session. But as Neil said, we're not going to be able to get all the questions answered in the 20-minute Q&A session. But as Neil indicated, we're going to do our level best to answer all of them, even if it means the overflow has to be done after, the main training session, after Q&A. And then we'll post out the responses that we weren't able to deal with in the Q&A session. So don't worry, all questions will be answered, some in the 20-minute Q&A session and some elsewhere. Thank you, everyone. Okay, 10 minutes have gone, so I think in the interests of saving time, we need to get going again. As a reminder, the next session will be 60 minutes, 60 minutes, after which we'll directly move on to 20 minutes of Q&A session. So you've got 80 minutes ahead of you. Many of you have listed in the Q&A box questions that you probably listed before Neil got to explain the responses which would have answered your question. So, for many of the questions that are listed in the Q&A box, Neil did get to explain and cover those questions already. So be aware of that as Neil goes along, he's going to be addressing some of the questions that you may have or have already been posed. So Neil, back to you again, please.
Thank you, Leo.
Yeah.
Yeah.
Could I just, some people asked about recordings. Just to remind everyone, the entire session is being recorded and it will be made available on the APMEN YouTube website. So, sorry, Neil, please continue.
No. Thank you, Leo. So also, Leo, I might be sort of mid-presentation after 1 hour, so please interrupt me and I will find a suitable stopping point and we can
All right.
continue
Fair
during
enough.
day.
I'll warn you 5 minutes beforehand, or a
Perfect.
few minutes beforehand.
Yeah, thank you. Perfect. So navigating the ESPT, the Entomological Surveillance Planning Tool. Now, this sort of framework that you see on your right actually can be applied to anything. And I absolutely use this for research, designing research studies as well. And the first step is, what is your question? What are you trying to answer? What is the decision you are trying to make? Then the next step is, what are the essential indicators? What are the indicators that will answer your question? And the next step is, what is the sampling method that will collect the indicators that will answer your question? Do you see how this works? And the next thing is, what site should we implement our sampling methods to collect the indicators that will answer your question? I'm pretty sure you can see how this works now. And then what sampling design at the specific site will enable you to implement your sampling method to collect the essential indicators to answer your question, right? And the last step is, once you have your sampling design, I would design the perfect, ideal entomological surveillance plan to answer your question, and then look at capacity and funding. And if you don't have enough capacity, let's say manpower or vehicles, and if you don't have enough funds, then go through the whole process again and reduce things. And I have an example to show this to you later on, I think on day 3. And you basically adjust your entomological surveillance plan to answer your question, but within your capacity and funding. And that is the primary sort of methodology that I use to not just design entomological surveillance plans with countries, but also scientific studies. Now, the next concept is a decision tree. Now, I'm a nerd, right? I'm a super nerd. So, what I do is, before I start anything, I try and think of every single possible outcome so that I factor everything into what I'm doing. So, let's say there's a decision, right? Or something, a question. And that decision has 2 possible things. You can say yes or a no. And each one of those goes to another question, which might be a yes or no as well. It's pretty simple to map these out into yes or no things. And at the beginning of your study, beginning of your question, if you map out all the possibilities, you've thought through all the processes. And at least this is how I function with science. So even though it might look complicated, in the end, what actually happens is you just work through a specific pathway, right? And this is sort of really useful because you've already thought through everything. So you haven't left anything outside, anything out of what you are actually implementing. You've already thought through everything. Now, as a note, this sounds kind of conceptual, but every single indicator that we're going to be examining, whether it's for baseline entomological surveillance towards understanding a system or to evaluate an intervention, every single indicator has a detailed decision tree going through all the processes. And for example, this is one of them. If you're trying to do indoor residual resting density, trying to understand the proportion of mosquitoes that rest indoors, you'd start here and you'd ask multiple questions. And here's a yes, and here's a no. If you know, is the indoor resting density known in unsprayed houses and sprayed houses? If IRS is conducted, if the answer is no, this is what you would do. If the answer is yes, you have this data, go to the next question. Are there vectors resting indoors? If the answer is no, this is your outcomes, or this is what you should do. If the answer is yes, this is what you should do. And even though this looks complicated, this actually maps almost everything you can think through when looking at an indicator. And in the example here, it's indoor resting density. So if you look through the ESPT has all these, download it, reference them, because in the interest in time, even though we have 3 days of 2-hour sessions, we cannot go through all these, but they're all available for you. So this enables you to think through everything before you even start. And let me try to get to the next slide. If you have any questions, so this is our core team of people that you can talk to at any point in time, message them, harass them, including me. Steve Goello is based in Malawi. Mercy Opio is she's from Kenya, but she's based in either Barcelona or Mozambique. Elodie Varsha just moved to Norway. Eddie Thompson is in Atlanta, and I'm right now in Uganda, but usually I'm in the US. So we're a pretty international group. At any point in time, if you have questions, thoughts, concerns, or even suggestions, we are happy to answer and respond to y'all. So when we look at the ESPT, it focuses on priority questions that help planning and prioritization. And this is especially true when we have less resources. It looks at human behaviors, which we believe is a critical component of understanding how interventions function. We can understand gaps in protection using human behaviors, and I'll go through this. And gaps in protection help us manage expectations. For example, if we have a site and we understand how bed nets function there, and we understand that bed nets will only get, let's say, 50% of protection, enable 50% of protection, we can go to our bosses and say, yes, we should implement bed nets, but it'll only be 50% effective. We can only possibly at the maximum reduce transmission by 50%. So this manages expectations, right? We're not going to get rid of malaria with this. We also have these gaps in protection that we have to deal with, right? So entomological surveillance is iterative and adaptive. And this is really important because, as we mentioned, transmission changes over time and we need to adapt and we need to change what we do to adapt to what's happening. And we want to be iterative. We want to examine the data coming through, examine the system and redo and change and adapt what we do so that we are better at what we're doing, so we can make better decisions. And that was a short end to the next slide, next set of slides. And I will give me a second while I switch slides, please. The next set of slides is, the next slide is actually a set of slides that I really like, which is conceptually a little different than other entomological surveillance trainings, and this is based on gaps in protection. So we're going to go over gaps in protection. Now, I hope you remember this, that intervention, vector behavior, and human behavior sort of overlapping Venn diagram. So a gap in protection is a circumstance, and now I'm reading, when an individual or a household is potentially exposed to malaria infection, to an infective mosquito bite. And this would be because of a lack of effective or adequate protective or preventative intervention in place that reduces that exposure to mosquito bites. So as I mentioned earlier, this gap in protection down at the bottom in red is what we want to understand. And if we understand that, it's actually a byproduct of understanding the protections. And if we understand the protection and the gaps in protection at our site, we are doing better than most everyone else. And here's an example with bed nets or insecticide treated nets, ITNs. How do bed nets work? Right? And on the left, we have the intervention, we have humans, and we have the mosquito. So bed nets function on late night indoor biting mosquitoes. We know that. With humans, humans have to be indoors and under nets for them to be effective. We know that. Mosquitoes must be susceptible to the insecticide and they must bite indoors late at night, right? So if we look at this, this is how bed nets function. And that is what ideally we would all do. Now we are asking if we could also look at how bed nets do not function. And they are both related to each other. On the left is how they function, on the right is how they don't function. And if we understand this, we are doing better than most. We are understanding our transmission system better than most people. Bed nets do not function on early evening or outdoor biting mosquitoes. Correct, because there's no bed net there. Humans who are not under bed nets are not protected. If they're indoors, awake, changing their clothes, cooking, or if they're reading, or if they're outdoors, just hanging out, perhaps cooking, playing, they're not protected. And if mosquitoes are resistant to the insecticide, bed net efficacy goes down as well. So if we understand the left side, which is what stereotypically people do, and if we complement it with what happens on the right side, how they don't work, we are doing better than most, as I mentioned. Would be ideally how we would function. And technically, we can do this with how normal entomological surveillance is conducted. We don't really have to adapt much. We just have to sort of continue doing what we're doing, but with sort of this at the back of our minds. The question is understanding how does my intervention function and how it doesn't function. So ideally, when we look at efficacy studies, for example, bed nets, right? If we do an efficacy study that is under ideal situations, how does my intervention work? And this is how all the WHO-based huge randomized controlled trials are based. The scientific studies, the research studies are based on efficacy. So let's say a bed net has 80% efficacy in reducing malaria. Now, when we take these bed nets and actually put them into a programmatic setting, when we implement bed nets, this is what actually happens. Let's say the provider compliance is 80%. Let's say access to bed nets is 75%. Let's say consumer adherence is 75%. Only 75% of the people who have access to bed nets use them. And let's say targeting accuracy. Let's say the mosquitoes, 75% of them are actually biting indoors late at night, and 25% of them don't. And if we look at field efficacy, like how long does our bed net last? How fast does it develop holes, right? Let's say that's 75%. Our effectiveness, which is different from efficacy. Efficacy is under controlled systems. Effectiveness is when we implement the intervention in real-world settings. What we find is, over time, the effectiveness might actually only be 20%. And that's unfortunate, but that is unfortunately very real. So when we look at efficacy versus effectiveness, it's important to understand all these things in the middle that actually impact how our intervention functions, how our strategy functions. And this is just using bed nets as an example, right? It's from 80% to 20%. And please do not try to memorize this slide. I put this just to make myself think through things. So there are vector-related gaps in protection. Each specific intervention has gaps in protection that overlap with the vectors, that overlap with human behaviors, that overlap with drugs and treatment-based interventions, that overlap with national strategies and policies, other drivers of transmission like rainfall, weather patterns. Everything is a really complicated system, right? And everything, all these interactions have gaps in protection. And so it can get really complicated. But we are going to focus in on bed nets, IRS, LSM, spatial repellents, or rather the vector-related gaps in protection or vector-related, entomologically related systems. So it's really important when we're looking at entomological surveillance. So even though we want to keep all these other factors at the back of our mind, we want to understand them, we're going to be focusing on these interventions out here. So the ones in blue, bed nets and IRS, are WHO recommended. LSM, or larviciding, is also a supplemental tool. I completely forgot to put in, I'm sorry about this, uh, house screening and things like that, which are also WHO approved. Spatial repellents, we hope, is coming up for a conditional recommendation sometime very, very soon, I hope. And then the others are also attractive toxic sugar baits, insecticides, and genetic modification are in the pipeline. And from a Ministry of Health point of view, from a decision-making process, we want to sort of keep these, the ones that are already approved that we can use with global funding, we want to understand how they work and how they don't work. But the others we want to also understand, so when they come up for use, when we can actually use them, we understand the processes behind them. So we want to understand the modes of action, or MOAs. We want to understand how each intervention works and how it does not work. And when we understand how it works, we can understand the potential of that intervention. If we do not have it at our site, how well will it work? How well do we expect it to work? Once we implement it, we can actually evaluate its efficacy or effectiveness. And then also, we want to see how the system responds. If you remember, things are going to change when we implement an intervention. So how does the transmission system respond to the bed nets, or IRS, or LSM? So we want to see how that happens. We also want to see how the intervention does not work. What are the gaps in protection based on the vectors, based on humans, based on many other things that might happen? And again, if we understand this, we are making decisions better than most people, and we are protecting people the best we can. And as an example, do you remember this? That's just a simple example. I've redone this slide, showing you the slide, because we can do this for every single intervention. I've done this for IRS and spatial repellents and LSM, but I haven't presented it here because I'm sure you can do this. So when we look at a site, to me, what I normally do is how do we best protect people? So we want to look at what are the gaps in protection at our site. And when we look at this, we immediately actually grasp how much we're actually protecting people at the same time, because they're the two sides of the same coin. How are we protecting people? How are we not protecting people? And so with the vector intervention, we would want to look at how the vector intervention functions, what the mosquito behaviors are, and what the human behaviors are. And I'm going to go through human behaviors in a bit, and this is actually, to me, super important. And when we analyze these three together, we can understand the protections as well as the gaps in protection. And we understand this tells us how our intervention is functioning and how to optimize the present intervention. If you remember the difference between efficacy and effectiveness, right? We can understand how to optimize it. How do we get the effectiveness as close to efficacy as possible, right? If you remember that previous slide where things keep getting reduced as each stage goes lower down the slide. And when we understand gaps in protection, we can understand the sources, the times and places where there is residual transmission, exposure happening. And this will tell us new interventions that might be needed in those spaces and times, how to fit interventions into those spaces and times, as well as if we have no more funding or we have no more capacity, it tells us what we cannot do anything about. And that's important to understand. It's important to understand our limitations, what we can do and what we cannot do. So if we understand the gaps in protection, we not just understand how our interventions function, we also understand how to optimize them. We understand where the continued transmission is coming from, and we understand what we can or cannot do about it. That's pretty important to me. And this is an important slide to me, one of the most important slides. Jose Najera, I hope I pronounced his name right, he said that before DDT, malariologists were trained to be problem solvers. And after DDT, malariologists were trained to be solution implementers. And this means that when DDT came about, it was such an effective intervention that the programs just told everyone in the program, go out, give everyone, spray DDT everywhere without having to think. People tell countries, give everyone a bed net without thinking. Give everyone IRS. Just do the intervention, implement the intervention. But people aren't trained to be aren't trained to be problem solvers. And we need to get back to that. And so that's what the ESPT actually does. It enables us, it helps us, it asks us to understand what the actual problem is at our site. Where is transmission coming from? What are the gaps in protection? And how can we then solve that problem of transmission at our site? And this is one of the primary things I'm asking you to actually focus on. Instead of being a solution implementer, I'm of malaria. And that is a quick summary to gaps in protection. And I'm going to start the next slide. As I mentioned, I am going to go back and forth between presentations. So thank you for being patient with me. The next set of slides is on question-based entomological surveillance. And that is sort of the first step in the ESPT, the first thing that we have to do when we are designing our entomological surveillance. I hope you can see this slide. I hope you recognize people on this slide. I think this is from Malaysia. I think, I don't remember. Oh, it might be Philippines. I'm sorry. So the first question is to identify your priority question. What is your question? What are you trying to do? So at the bottom, you can see the different stages of what you have to incorporate into your entomological surveillance design. What is your question? What are the indicators that answer your question? What are the sampling methods that collect the indicators that answer your question? The site selection, sampling design, and capacity and funding, as I went through earlier on. And right now, this stage, we are at here. What is your question? And throughout the next couple of days, we're going to go through all these steps and go through the specifics of each one. Some of them are really short presentations, some of them are longer. Like the next set, minimal essential indicators, it's quite long. We'll have to go into tomorrow, I'm sure. So why is question-based entomological surveillance so important? So entomological data must be guided by a specific program relevant question. And this is directed towards malaria control decisions. And as I mentioned earlier, many countries collect a ton of data. If you look at your country data, I'm sure you have a lot of data. And when you look at the decisions made by a country for entomological vector control, you will probably note that a lot of the data you collect doesn't even feed into that. So if we want to have a specific question, so then we can answer that question that can directly inform decisions. The specific question that you ask directly shapes the surveillance design. It impacts absolutely everything with your entomological surveillance. It impacts which indicators you collect, the minimal essential indicators. It impacts your sampling, your survey methods, and site selection. It impacts everything. So getting your question right is super important. And note, if you're designing entomological surveillance right now, think about what your question is. Think about how to answer your question and what is most important for your country, right? What is most important? What are the decisions coming up? Ask yourself, what is my question before moving forward whatsoever? Defining your question is the essential first step in planning entomological surveillance. And even though there are a ton of different questions, the ESPT has 6 sort of overarching themes. And because there are so many different kinds of questions, I'm going to go through all these slides pretty quickly and sort of give you examples of each kind of question, so that you can just understand what kind of questions you can ask or how to ask a question. And I'm going to have a sip of water while you read through these 6 types of questions. Thank you. So we can actually understand question type 1 is current vector control intervention performance. How do we evaluate the current strategy or what's being implemented? The second one is the selection of interventions. The third one is understanding drivers of malaria transmission. The fourth one is what happens if there's a reduction in funding, reduction in capacity, as has happened worldwide recently. What do we do? How do we adjust our entomological surveillance? What is the most important thing to settle on? What happens if receptivity changes or prevention of reintroduction of malaria in those kinds of settings? What do we do? And as well as specific questions that don't fit under any category that can help us make better or tailor our entomological surveillance activities. So when we look at the type 1 current vector control intervention performance, here are some questions. I'm just going to read through them. What is the baseline vector composition, distribution, and behaviors in an area where interventions are currently deployed? And this can, as I went over in previous slides, this can help us understand several things: how our intervention is working, how the system is responding, so many things we can understand with this question. Another question is, how do current interventions impact vector populations and malaria epidemiology over time? Another question, these are all examples, of course, are local vectors susceptible or resistant to the insecticide-based intervention? Another question is IRS effective in a specific area based on the vector behaviors, human behaviors, and insecticide susceptibility? So you can see these kinds of questions can be asked by you. When we're looking at question type 2, here's another sort of 4 examples of questions. Under selection and evaluation of some supplementary interventions. A question is, again, what is the baseline vector composition, distribution, and behaviors prior to the introduction of an intervention? So we want to understand that to see how our intervention maps over or functions with our local vectors. What are the gaps in protection? And what are the available interventions that can address those gaps? That's an important question because we'd understand what is the best intervention to implement at that site. Where and when should supplemental interventions be deployed in an area? What is the timing of the intervention? Should we put it in January, the beginning of the transmission season, or the end of the transmission season? What intervention should we put in at that place? Beginning of the rice season, end of the rice growing season? All these questions can be asked. And very importantly, when we put an intervention, how do vector populations change? How do the behaviors change? How does the system respond to your intervention? So here's an examples of questions under type 2. When we're looking at drivers of malaria transmission, questions we can ask are, what are the potential entomological drivers of malaria transmission in my area? And we can look at vector behaviors, species compositions, insecticide resistance. We can see how this is related to climate, rainfall, or lack of rainfall, multiple things, or human migration even, right? How does human behavior affect intervention usage, acceptance, and exposure to vector biting? Suppose people at a specific site just don't like bed nets. And this has happened in so many areas, right? But people just don't use them, or they use them for different things. And here's an important question as well. What is the associations between vectors, rainfall, and malaria incidents? And this will tell us the timing when we should put in an intervention or what interventions we should target. What happens when funding is reduced, right? What is the priority entomological surveillance activities that we can implement when funding is reduced? And note that with entomological surveillance, if it's well designed, we can answer multiple questions at the same time. And that's an important thing to understand. If you have multiple questions, design your perfect strategies and then overlap them to see, for example, our human landing catches or CDC light trap catches can answer multiple questions at the same time. What are the minimal essential indicators that should be collected to inform the vector control strategy, right? We don't have to collect everything, right? What entomological surveillance activities can be conducted with the current program capacity based on my funding that has just recently gone down? How do we fine tune? How do we focus in our entomological surveillance activities on what is most important? If receptivity changes, how does the vector populations change over time in areas trying to prevent the reestablishment of malaria, right? How do various changes increase the potential for malaria transmission? For example, if imported parasites were reduced, especially in areas where we've eliminated malaria, which I hope becomes all your countries. And what action can be taken to address critical changes in receptivity? For example, huge amounts of rainfall or a flood or an influx of immigrants or migrants, right, who might have malaria. How do we take these things and factor them into changes in the transmission season. And of course, here are questions that might be very random and might not fit under any of these categories. For example, let's say my country decides that HLCs, or human landing catches, are not appropriate or not ethical. Can CDC light traps capture the same amount of data, the same type of data? Is it a valid proxy, right? Or questions like, I want to do insecticide resistance tests and I need my primary vector in a lab colony, susceptible Anopheles, let's say arabiensis, in a lab colony. Can I successfully rear this in an insectary? Even though it's not directly entomological surveillance, we might need it for entomological surveillance activities. Another question is, which method is most effective for collecting indoor resting mosquitoes in an area? Like, should I use PSCs or indoor aspirations? So even though they are both collect indoor resting mosquitoes, the outcomes, the outputs are slightly different, right? Depending if you're doing hourly indoor aspirations or pyrethrum spray catches in the morning. Think about how they're different. We might get to this on another slide, right? So when you're answering these questions or identifying these questions, sorry, not answering, when you're identifying these questions, factor in other data that you might have, such as epidemiological data, trends in cases. Is there an outbreak? What are the risk factors already present, right? Ask your question considering the entire system that's going on, all the information you have in your system, right? And specific decisions might be need to be made based on your question, right? For example, procurement, targeting and tailoring of vector control interventions. Or let's say you have your annual work planning meeting, right? The timing of entomological surveillance. So consider other factors when identifying your question, right? And as a last slide for this short presentation, your question directs everything. So get your question right. Make sure that you understand it because it really, really is important. And as I mentioned, a short slide, set of slides on asking your question. And my next presentation is a rather long one. Leo, are we almost at time?
No,
Should we?
Neil, we have another full half hour, in fact. So,
Oh, perfect. Good.
yeah,
So I
okay.
can actually, yeah, perfect. This is good. For a
Please
second,
sally forth. Thank you.
uh, perfect. So this is a longer presentation, and I'm going to have to stop in the middle when I'm instructed to by Leo, and we will continue tomorrow. And the next step is to select your minimal essential indicators. And over here, we will go over multiple indicators, entomological and human behavioral and intervention indicators. And it's really important to align your indicators with your question. What are the indicators that answer your question? And we'll go through examples later on, right? And we'll support prioritization. We'll try to figure out how to identify the minimal set of essential indicators. And we are here right now in the second step. So again, I mentioned earlier, in malaria programs collect a lot of data, a lot of which goes unused. So how do we focus in on the data that is vital to answering our question, vital to program decision making, right? Here's an example now. Here is multiple indicators on here. You don't have to pay attention to how they're organized, but they're sort of vector occurrence. Is my vector present? Vector density. What is the seasonality of our vectors? What is the biting behavior? Do they bite indoors or outdoors, which is a place? What time do they bite? At 6 p.m., midnight, or 6 a.m.? Resting location. Do they rest indoors? What proportion of vectors rest indoors, right? And I'm sure you realize the resting location is important for a specific intervention, IRS. Insecticide resistance, the resistance frequency of the resistance status. Are they resistant? What proportion of them are resistant? And of course, you have your immature indicators. Receptivity. Are they actually vectors at my site? Are they larval habitats? Are those which larval habitats are actually occupied by the vectors? And what is the larval density there? Now you have all these indicators, and this is just a really, really small set of indicators present. And let's try and look at an intervention right now. Let's look at IRS. Now, think about this. Now, normally I'd go back and forth with you all, but with over 2,000, 900 people, I don't think it's possible. So think about which of these indicators indicators are essential for understanding IRS. And here's where we go back to that slide where how bed nets function and how they don't function. How does IRS function? IRS functions on indoor resting mosquitoes that are susceptible to the active ingredient or to the chemical that you spray on those walls. That's it. So when you look at your minimum essential indicators, if you want to understand how IRS might function at your site, of all these, now this might be controversial, those are the only two indicators you probably need to collect based on your question. What proportion of my vectors are resting indoors, and are they susceptible or resistant to what I'm going to spray on the walls? And if you design your entomological surveillance well enough, you can capture other indicators that actually help you with decision making. It'll help you tell you which vectors are causing the disease, which ones are resting indoors, which ones are not, what's the seasonality of them. So it can tell you when to implement your intervention. Is resistance coming up, right? So if you design your surveillance based on your core minimal essential indicators, you can actually collect a bunch of other indicators without much extra funds or capacity at all, which improves your understanding of your entire system. If you look at bed nets, now think about this quickly without responding to me in the chat, but think about it. Which are your minimal essential indicators? I'll give you 3 seconds. There we go. The minimal essential indicators are: how does bed nets function? Indoor, indoor late night biting, so place and time, and insecticide resistance. That's it. If you collect indicators, if you understand these factors, you will understand how bed nets may function at your site. And if you design your your surveillance strategy well enough, you will collect other indicators without extra effort. Same thing with larval control. Let's say you're doing larviciding, or let's say habitat modification. The most important indicator is habitat occupancy. Which sites have my vector in them? Because those are the ones you'd want to treat. Those are the ones you'd want to eliminate. And again, if you design your strategy well enough, you can collect this. I also forgot right here to color code the vector occurrence and vector density, because you can collect that as well. I'm going to make myself a note of that so that I do that later on, because I've actually forgotten to do this. Sorry about that. So you can collect extra indicators without much effort. And when, as I mentioned earlier, when you implement an intervention, you immediately you change transmission. And the 3 things you want to monitor over time are right here. Changes in mosquito composition. Please memorize this. Changes in behavior that impact how your intervention functions, and the emergence and spread of insecticide resistance. And your changes in all these 3 things are dependent on your intervention mode of action, right? Based on how your interventions functions, whether it's IRS, bed nets, or anything else, your mosquitoes, your vectors would change differently. The changes in composition would differ, changes in behavior would differ, and your insecticide resistance would be based on your active that you're implementing. Correct? I hope this makes sense. This is how I would go about choosing the minimal essential indicators for my entomological surveillance to answer my essential question. So I'm going to go over all these indicators very briefly, because I'm pretty sure you understand all of them. All of their definitions and how to collect them and everything are in the ESPT. How to calculate them is in the ESPT. And the pros and cons of all of them are in the ESPT, and I'll go over that as well. But we will very briefly, and some of them have examples of vector species, larval habitats, receptivity, seasonality, and all these will be done in the next few slides. Vector species composition. In each of the slides, I have the definition and how to calculate it. I don't have to go through every single one of these because I'm pretty sure this is recorded so you can reference it. And to save time, we will just go over all of them briefly. And I'm going to have another sip of water quickly. Thank you. Vector species is a vector species in an area and the proportion of overall abundance. And for example, this was a paper from 2012 from Marianne Simca. And this maps the primary vectors in the world geographically. And if you look at this, and if you look at your site based on the data you know that this is probably not 100% accurate. That at every site you have multiple vectors, and based on the season, you'll have multiple differences happening, right? Different vectors pop up at different times. So understanding how things like this, slides like this, differ from what's actually happening at your site and how to function, what to understand is actually pretty important. Different mosquitoes, every single one of these has different behaviors, further complicating absolutely everything we do. And here's an example. And this is an example from Kenya, where at the beginning, on the left, on the y-axis, we have the number of mosquitoes caught. On the x-axis, we have year, 1, 2, 3, 4, and 5. Now, this line over here is the amount of malaria that was present. So initially, there was 80 to 90% of the population had malaria. Malaria prevalence was really high. And in green, there was Anopheles gambiae. In red, Anopheles fenestis. And blue, Anopheles arabiensis. These three mosquitoes had different behaviors. One of them, gambiae, likes to bite indoors, prefers humans, less animals, but it also feeds on animals. Fenestus loves humans and loves to feed indoors. Arabiensis prefers to feed outdoors and mostly feeds on cows and other animals. And you can see the proportions of mosquitoes over here. And what happens when bed nets and iris were introduced? As we went over in previous slides, this would impact some mosquitoes specifically. And the first impact you'd have, right, since you're changing transmission dynamics, is on species composition. So the mosquitoes that are most impacted would be the ones, how do bed nets function? Indoor biting, human biting, right? So the most impact would be on the red and on the green. The red went down, the green went down. And the blue, Anopheles arabiensis, which was outdoors and fed on animals, didn't change much over time. So malaria went down proportionally because the primary vectors were impacted the most, the green and the red. And the blue one didn't really change. So malaria went down to 20 to 35%. And that was sustained by these mosquitoes and by the behaviors of those mosquitoes that continued in the system. And what actually happened in year 6, 7, 8, 9? The second response to the intervention started happening, where the Phenestis and Gambi started to have insecticide resistance and they changed their behaviors. And the red and the green popped back up, which is not on this slide. And insecticide resistance started coming up and their populations went up. And guess what happened to malaria? It went up as well. So understanding this at your site, what are the mosquito species? How might they be impacted by malaria is really important. Larval habitats, the next indicator. There's a proportion of habitats with Anopheles larvae in them. And this is pictures from different sites. You can see we're taking pictures, trying to characterize them, the different numbers. This is just my way of making sure that I understand which site was where and the characteristics of each of them. And you can see my bald head over there collecting mosquito larvae. So over here, we were trying to characterize mosquito sites because there was huge larval interventions over here, LSM, and this was in Halmahera in Indonesia. And what we found is we went through all the potential larval habitats, and we mapped which ones actually had larvae in them. And if you look through these sites and try to imagine which ones actually had larvae, you might be right, you might be wrong, but in the end, the data actually demonstrates which ones actually had larvae. And those were the ones that had larvae. And very weirdly, and unfortunately, before we did the study, the villagers, the people in these sites, were actually treating habitats 9, 4, and 19, and only 4 had larvae, and they completely missed 5 and 7, which was unfortunate. And very weirdly, these tire tracks, number 7, were super productive. And you might realize this, that even in Africa, like cow hooves, little hoof prints with Anopheles larvae in them might be very productive. Receptivity is the presence or absence of Anopheles vector species, if they're actually there. And this is usually measured by larval densities, actually looking for larvae. Seasonality, I'm sure you understand this, the season of primary malaria transmission, and also that's related to mosquitoes. So if you actually look at the overlap between mosquitoes and rainfall, you can actually understand your seasonality of malaria transmission and the drivers of it. So, for example, over here, you have rainfall in orange driving your mosquito populations. At some sites, especially those that are mountainous, rainfall might reduce malaria because the rainfall washes out all the larval sites. So it's important to understand the exact relationship between these different things because it might differ at different sites. So rainfall in mosquitoes, though we normally assume more rainfall equals more mosquitoes, it completely depends on your site. Endophagy versus exophagy. This is biting location. Where do mosquitoes prefer to bite human beings? This is the proportion of mosquitoes biting indoors or outdoors by species, by location and time. And here's an example also. This is published. This is also from Kenya. And remember, we talked about maybe 3 or 4 slides ago, Anopheles gambiae likes biting inside in humans, Anopheles arabiensis likes biting outdoors primarily in cows. What happens initially? You can see the proportions. Now, these are proportions and not absolute numbers. Proportionally, there were a lot more gambiae, which is in black, than arabiensis, which is in green. And once they put in bed nets, right, it impacted the black, the Anopheles gambiae, much more than the green Anopheles arabiensis. And the proportions started changing. And over time, for example, by 2007, there were a lot less of black Anopheles gambiae and a lot more proportionally of Anopheles arabiensis. So behaviors, of course, were very important. This slide does not have Anopheles fenestis in it, which is primarily endobiting and human feeding. And you can imagine what happened to that. But this was published in 2010 by Nabi Bio. The biting time. What time do mosquitoes bite? This is another indicator which is important because we understand where and when mosquitoes will be looking for humans to bite. And that's important because that's where we would want to put an intervention in. So the blue line is, for example, the y-axis is the number of mosquitoes. I didn't even label these. This is completely wrong of me. The y-axis is the number of mosquitoes, and the x-axis is the time over the night. And you can see the blue line is mosquitoes biting indoors. They bite primarily in the middle of the night. And the orange line is outdoor biting. And you can see primarily bite outdoors in the evening and in the morning. And if you overlap this with human behavior, which data we don't have, I would imagine that the mosquitoes are actually following the humans indoors. And as they go outdoors, the mosquitoes are they're following them from outdoors to indoors and then outdoors again. Because just like me, if there's food, I'm going to run behind it because I love to eat. So the mosquitoes are doing the same thing. They are following the food, which is us. And here's an example of biting time, which is actually pretty important. And actually, this demonstrates changes in behaviors. In the Solomon Islands, there are 3 species, Punctulatus, Ferrauti, and Coliensis, and each of them had different behaviors. And what you can see is that in 1971, all these mosquitoes fed primarily in the middle of the night. The y-axis is again the number of some mosquitoes, and the x-axis is time over the night. The 24 is midnight. And then they started, this is pre-DDT spraying. And then they sprayed DDT, and what happened? The mosquitoes changed their behavior from middle of the night to early in the evening. And that's because we were selecting for the mosquitoes that did not feed in the middle of the night. Because if they went indoors in the middle of the night, they'd get killed by the DDT in there. And what happened was we had this study in the Solomon Islands where we were trying to figure out now, I think it was 10 years ago, now 10 years ago, what is happening with this transmission season? They have bed nets, they have IRS, and why is malaria not going down? And they had been doing this since 1972. And what we found is Anopheles ferrati in the Solomon Islands, now being 10 years ago, well, 2012, the date is right there, we found that again, the biting rate on the y-axis and the time of the night on the x-axis, we found that most mosquitoes, just like in 1972 in the previous slide, most mosquitoes were biting outdoors early in the evening, and by 9 o'clock they stopped biting. A very few were going indoors. So all the biting was primarily happening outdoors and less indoors. And in the evening, not later on, not earlier on. Sorry, not later on. It was happening earlier on. And the implication is that indoors, they had IRS in the red line and people were using bed nets. But 84% of the biting was happening when people were outdoors and unprotected. Right? The mosquitoes changed their behavior because of the IRS and bed nets, and we're now feeding outdoors. So all this residual transmission was happening outdoors. And it's really important to understand endophagy, these entomological indicators, and exophagy, where and when are mosquitoes biting? And this is an example of it. Indoor resting density. This is the amount of mosquitoes, the proportion of mosquitoes resting indoors. All these indicators, I have to mention, should be done by vector species because each vector species has different behaviors. And this indoor resting density is, of course, based on IRS. The frequency of insecticide resistance, I'm pretty sure everyone does this and you understand it, WHO bioassays or CDC bottle assays. Bioefficacy of interventions, and this is to evaluate how your intervention is functioning over time. So, for example, this is a cone bioassay to understand how the bed nets function over time. How active are the bed nets 1 month post-distribution, 1 year post-distribution, 2 years post-distribution? And it's important to understand that because with bed nets, at least, the implementation cycle is 3 years. So at the end of year 2 or end of year 3, are my bed nets still functioning as I expect them to function in year 1? Right? And if the answer is no, we're not protecting people well enough. And we all know that bed nets degrade much faster than the 3 year timeline. So this is something to consider when moving forward and understanding how to protect people better. Intervention coverage. This is important because this is the proportion of people that actually have the intervention, right? And this is associated with intervention usage. Just because I have the intervention doesn't mean I use it. If I have 5 bed nets and they are very neatly wrapped up and stored in a drawer underneath my bed or stored in the dresser, they are of absolutely no use. So intervention coverage and intervention usage and understanding both of those are really important. And this is a nice picture of a little child sleeping outside a bed net that's already up. And here's an example of, yes, they had access, they were covered by bed nets, but this little child was not sleeping under a bed net. Intervention usage, they were not using the intervention, thereby reducing effectiveness. Now, using this same slide, besides mosquito behaviors, when we are trying to understand how bed nets function, what is another indicator that demonstrates how interventions might succeed or fail? Just from this slide, you can see the child is sleeping outside the bed net. And this doesn't have anything to do with the bed net. This has everything to do with humans. Human behavior is super important. And this can be this can be completely different as well, right? It's not just the population as a whole. Men and women have different behaviors usually in village settings, in traditional settings. Children have different behaviors. Different people with different jobs have behaviors. For example, if I'm hunting in the forest, or if I'm collecting mushrooms in the forest, or if I'm a fisherman, or if I'm fishing late at night, if I have to stay in the fields to guard my crops, right? All these are different behaviors that are related to how people are exposed to malaria, to the malaria infection. And understanding all these are really important to understand how to protect people. And we can actually do all this. And I'm actually going to go over this in the next few slides. Human behavior is really important. How do we characterize human behavior that impacts transmission and intervention effectiveness? Now, in the ESPT, when you download it, there are a couple of tables that outline all these things. So one of the things we were thinking of when we were doing the study is that, or rather designing the ESPT, is that on this planet, in this world, there are a bunch of people who know far more than me. who know far more than you on various specific things. And we wanted to engage all these people who knew far more than all of us and distill all that information together so it's available to everyone. So that, for example, when I don't understand something, I can reference the ESPT and that information is there. So I don't have to go out and get a PhD. I don't have to go out and take a training course. It's already in the ESPT. And the ESPT, Table 1, when you download it and when you reference it, has minimal essential indicators based on the minimal essential indicators based on your question. It has supplemental indicators or nice to have indicators. It has performance indicators and human behavior indicators. And here's an example. Table 1 is on page 9 of the PDF. Vector occurrence, right? Here's the outcome or the definition and why it's important. So you can go through each of these to understand exactly how each indicator functions, or minimal essential indicators. Table 2 are supplemental or nice to have indicators. If you have lots of funding and lots of capacity, there are some indicators that may be really nice to collect, and not necessarily, in addition to the ones you're focusing on, in addition to the minimal essential ones. And for example, human blood index, it can tell you, the proportion of mosquitoes that prefer humans versus cows or dogs or things like that. When you want to evaluate an intervention, Table 3 on page 12, and if you go through this, it can tell you, for example, how long bed nets function, durability of them, right? And why it's important. So all this is outlined in these tables, which of course we do not have time to go through, but it's in there. And based on your question, based on the indicators you select, you can read through this and understand them comprehensively.
5 more
Now,
minutes, Neil, before
oh,
break.
I
Yes.
totally got a scare. Which is normal because I get wrapped up. Thank you, Leo. I will finish this and start the question and answer session. If you have, if this is recorded, you'd probably see me have a huge scare just now, but that's kind of funny. Anyway, human behavior. So this, as we mentioned, is really important. And we will actually now go through the next step. I'm going to actually stop here, Leo. I'm going to stop on this slide as a preparation for tomorrow. So I was in Papua, Indonesia, and some of you might have seen this before. And I was doing human landing catches. And for all those who do not know what human landing catches are, it's a mosquito sampling method, and I'll go over this as well. And it's a mosquito sampling method where you use yourself as a human bait, where you sit down and you roll your pants up and you put your leg out and you wait for mosquitoes to land on you. And it's called a human landing catch because you're trying to catch a mosquito before it bites you. Human landing. And ideally, you'd catch the mosquito before it has a chance to probe. But what happened here was we were catching, I was sitting from 12 to 6 in the morning. So in the middle of the night, I was sitting out there and there were so many mosquitoes. I couldn't catch all of them. By the time I started catching a few with my aspirator, the others were biting the other leg. By the time I moved to that leg, they had landed on my left leg. I was getting, I think, 400 per hour, or in 10 minutes, I've forgotten, but there were way too many mosquitoes. And while I was catching mosquitoes on my leg, if any of you saw a picture of me, my beautiful bald head was a buffet for all the other mosquitoes out there. So I was catching them on my leg, they were landing on my head. I was going crazy. And this very weird situation made me realize that I was sitting out there from midnight to 12 to 6 in the morning. I couldn't deal with that entire timeline, by the way. And this is how my leg was getting chewed up. And I thought everyone is being exposed from midnight to 6 in the morning. And I looked around, and the only idiot sitting outside at midnight getting chewed up by mosquitoes was me. Every single person in the community was inside, hopefully under their bed nets. So historically, right, we've been looking at human landing catches or CDC light trap catches as an indicator of community exposure. But as you can see from this example, from this awful leg, picture of my leg, what was happening to me, the human landing catcher, was not happening to the community. And understanding what is actually happening to the community is more important than this horrible leg out there, correct? And in the next set of slides, we will actually go through how to understand, how to translate what happened to me, what happens to a human landing catcher, what happens to the data we normally collect, right? With human biting rate, with our HLC collections, the CDC light trap collections. We can translate that. How do we translate that into what is actually happening to the community? Where and when is the community and how much are they being exposed to infectious bites? And I will stop there and we will continue this presentation tomorrow. Thank you, Leo, for the reminder.
No, Neil, I think on behalf of our esteemed audience from all over the world, we are grateful to you for an absolutely wonderful session, jam-packed with information, insight, wisdom, so much knowledge being shared there in such an easily digestible way, well explained. So, Neil, from all of us, very well done and sincere thank you for sharing that accumulated knowledge by yourself. So, thank you for that. There have been about, as far as I can tell, about 61 questions. I've harvested a random mix from the start to the end. I've plucked out 14 because we only have 20 minutes available for Q&A session. Don't worry, we will answer. Neil has volunteered to answer all questions, but we can't do it in the next 20 minutes. We'll do some in the next 20 minutes. The rest will be responded to afterwards. So to all of you, thank you for your patience, your persistence in hanging in there for more than 2 hours. It peaked at a high number, and by and large, that number has sustained throughout right up till now. So it shows the level of interest. Neil, I put the 14 questions, I think it's about 14 that are harvested on a word sheet. I'm just going to share that and list them to you. Can you see that there, Neil?
It's just showed up, yes.
Okay.
Yes.
So, shall we just take it top to bottom? We can either do these harvested ones or we can go to the Q&A long list. But maybe let's just focus on these. I've screened them a bit and reworded slightly to clear up grammatical issues and so on. Prof. Neil, I understand the daily survival rate and the reduction in transmission. However, in a real world dynamic state and in a transmission season, does the daily survival rate become reduced when new mosquitoes keep emerging during the favored breeding conditions? Are these considered in the calculation? I think there's a misunderstanding on the part of the person posing this question. Can you just clarify that? Let me not answer the question. You go ahead, please, Neil. Yeah.
And Leo, please feel free to answer questions as well, because you're just as knowledgeable as everyone. So the answer is, so the 80% survival rate was based on a calculation on anopheles in Africa. So this might change based on the specific species and the specific location. But the concept is that the vector control interventions, adult vector control interventions, impact the age structure. So if it's 80% or 70% or 90%, right? Either way, conceptually, vector control interventions impact adults, and their age structure would impact transmission most. But your point being that the daily survival rate might change based on season is quite possibly true based on, for example, the availability of predators or, temperature going too high or things like that. So things can impact the daily survival rate. And this is not necessarily captured in that calculation because that was sort of conceptually trying to explain how vector control interventions actually impact transmission because they impact the age structure of the mosquitoes. I hope that made sense. Yeah, and feel free to resend the question if I didn't answer it again. And after these sessions, I will go through them all and try to answer them myself, spend the time answering them myself.
Thank you,
I hope that
Neil.
answered the question. Yeah.
Thank you for that. Would the Bayer, question 2, would the Bayer curve differ for P. vivax? So is it different for different Plasmodium species?
Yeah, that's a great question. Thank you for that. So the Bayer curve was developed for Falciparum, right? In Africa. And I think it would change. So the Bayer curve for new cases for Vivax might not change, but since we can't tell the difference, it would probably change. Yes, you are right. Yeah.
Okay. So, thank you, Neil. As Neil said, if either I captured your question incorrectly or you wanted further clarification, please pop it into the Q&A box again. Question 3, what should one measure, in other words, surveillance, in an area where malaria is newly introduced, did not occur there previously, or there is a threat of malaria introduction, such as post-elimination and the risk of reintroduction?
Perfect. That's a great question. And so I go back to the first step, right? So what is my question? So depends. So this completely depends on what your specific question is. If you're trying to understand the drivers of protection or of transmission, or are you trying to understand what intervention to put into place? And for each of those, you might answer a different question and choose different indicators. So if my question is, I don't have malaria at my site. And all of a sudden, malaria has showed up in my site. And if my question is, what are the vectors? I would select specific indicators. If my question is, what intervention should I put in? Is IRS better or bed nets better? Then I would pick specific indicators that would answer that question. So I would formulate my question based on what's happening and answer that specific question. So over here for this sort of question, this sort of very general question, which is important. My questions might be, what are the vectors? What interventions should I put in? What are the continued gaps in protection that might happen based on the intervention I put in? Things like that. I hope I answered that, but we'd want to first get a very specific question that we can answer. But if I were to do this, I would understand the vectors, their behaviors, towards putting in an appropriate vector intervention, as we went over in the first few slides. Yes, I hope I answered that.
Thank you, Neil. Next question, can we use the malaria test positivity rate obtained using blood smear and RDTs as a proxy indicator for the level of malaria transmission and prevalence?
Yeah. So if I understand this correctly, the question is, can we use prevalence surveys to understand malaria transmission? And the answer is yes. I think this is what is normally used in malaria indicator surveys, where you look at across the communities, they test a random set of people to understand the amount of malaria at that specific point in time, which is called prevalence, malaria prevalence. And you can use measures such as RDTs or blood slides. And each of these have their positive points and negative points. For example, RDTs and blood slides have a specific sensitivity, right? So you will miss subpatent infections. You will miss infections that are below the threshold of RDT detection. So you will detect a certain number of cases, but not necessarily every single one of them. To increase that detection rate, you might want to do molecular surveillance, right? So things like that. But yes, to be able to understand the amount of transmission at your site, malaria diagnostics such as RDTs, blood slides, or molecular diagnostics can be used to understand the amount of transmission and prevalence. Thank you.
Thanks, Neil. Thank you. Next question. How effective is vector surveillance for malaria control? And the corollary, and how does it contribute to the control of asymptomatic malaria?
Cool. Oh, this is so many things are flooding my head. So many things. I can answer this question in so many ways. So malaria surveillance for vector surveillance for vector control for malaria control is actually very important to me. As I went over in the previous slides, you understand where the transmission's coming from, where you can protect people based on the interventions, what to put in there. So it's actually very, very effective. This is one of the core principles for effective malaria for strategies, for not just selecting strategies, but how to change and adapt your strategy. To me, it's a very core thing we have to implement for combating malaria. And how does it how does it impact asymptomatic malaria? So vector surveillance or vector control interventions impact all malaria, all cases of malaria, symptomatic or asymptomatic. The thing is, we normally only measure symptomatic or patent infections with RDTs, or if it's passive case detection, such as at health facilities, it's only the symptomatic people that go there. But the amount of malaria gets reduced across symptomatic, asymptomatic, patent, subpatent infections. To be able to understand that, you'd probably want to do asymptomatic diagnoses, such as molecular assays. But another thing is, which further complicates this question, is that as malaria transmission goes down and people get exposed less to malaria because of vector surveillance or because of vector control measures, people's immunity goes down as well, which means asymptomatic malaria might go up, right? Because their immunity is down. So it's a really complicated question. But overall, vector surveillance for malaria control is super important. And appropriate vector surveillance, which appropriate decision making, can impact all malaria, asymptomatic or symptomatic. Thank you. I hope I answered that okay.
Thank you, Neil. I love this question. Next one. Uh, how do programmatically relevant questions tend to vary between entomological monitoring programs in Africa versus Asia? Do you ask different questions?
Great. That's a great question. And I'll start off with a lot of programs don't actually ask questions. They just conduct surveillance, right, without asking a question. That's the first response. But when we actually have programs that ask questions, they are usually based on intervention selection and intervention evaluation. And this is usually based on what they can implement. For example, if you have global funding, it's all based on WHO recommendations. So a lot of questions are focused on bed nets and IRS and changes in the transmission system once bed nets and IRS are implemented. That's if they ask a question. A lot of programs just implement entomological surveillance without asking questions. So in Asia, in Africa, a lot of it is based on bed nets because that's a very primary question I see. And in Asia, since bed nets and IRS don't function as well because of mosquito behaviors, right? A lot of questions might be focused on alternative interventions and what else can we do. And countries like Malaysia, for example, are implementing so many innovative things that are really successful in a lot of ways as well. So they ask different questions. I hope I answered that question okay.
Excellent. Thank you, Neil. Here's another interesting one. After day 10 to 14, when mosquitoes become infectious, how frequently do the mosquitoes require feeding to maintain that infection?
Oh, this is another question that can take a while. So once a mosquito gets infected with malaria, the thought is that they are infected for the rest of their life. And just like humans, the mosquito is infected with the disease, right? So some of them actually are refractory, will not get infected. Some of them will get infected and be kind of sick, and some of them will be infected and die. So depending on that specific mosquito and that species, different things can happen. But for the rest of their life, unless we treat them with ACTs, they should have malaria.
Thank you, Neil. So, yeah. Next one. Is it important to know about the role of subspecies in disease transmission, especially Anopheles stevensii and Culicifacies?
Oh, this is such an important question. Thank you for this. So subspecies have different behaviors. So if you remember how species-specific behaviors impact transmission differently and they impact intervention if efficacy differently as well, so subspecies, if they have different behaviors, they will impact transmission differently. And so you want to direct your efforts to different subspecies differently based on what's happening. For example, Anopheles stevensii, there are multiple forms. One of the forms is very urban and prefers urban larval sites, and one of the forms prefers rural larval sites. And as you might imagine, depending on the form you will have transmission possibly happening in urban versus rural sites. And understanding that is important for how you would combat that. Same thing with Anopheles gambi SL, right? We have Anopheles gambi, we have seven, I'm not sure of the number right now, it keeps changing, species within that complex, and each of them has different behaviors. And some of them are not even vectors of malaria. So understanding what's happening with those subspecies or those cryptic species is really important. Thank you for that.
Thank you, Neil. Next one. How important is vector surveillance in a region or country with low transmission near elimination? And how can this be used to monitor elimination surveillance?
Oh, a very important question that I hope all of us get the chance to answer because we're going to eliminate malaria. So vector surveillance is sort of always important because we understand what's happening to the system. But as malaria transmission goes down, as it goes lower, right, it's easier to focus in on an infected person than mosquitoes flying around. So as malaria transmission goes down, test and treating. Or you remember the two reservoirs of transmission in mosquitoes and humans? As transmission goes down, it's easier to focus on a larger number of mosquitoes. So even though vector surveillance is important throughout because we understand what interventions work and how to prevent transmission, it would be easier, and of course this might be a little controversial, it might be easier to focus in on those cases of malaria and reduce that reservoir while at the same time maintaining your vector surveillance to understand where potential outbreaks might happen or where pushes against the system, where responses to our interventions happen from the vector perspective. So I wouldn't reduce both, but based on capacity and funding, I would adapt and focus in on what is most important to get rid of that malaria.
Thank you, Neil. So four more minutes, Neil. Then you can take a breather and relax a little bit.
Yeah.
So next question is, can collections from CDC light traps be used to calculate the entomological inoculation rate, presumably in contrast to human landing catches?
So yes, and yeah, the short answer is yes. And the caveat is that CDC light trap catches do not catch the same proportion of mosquitoes or same human batting rate as with HLCs. So in the perfect world, if we understand the relationship, the catching rates of CDC light traps and HLCs, we can have a translation factor, as in like one mosquito caught in an HLC is equal to 0.5 mosquitoes caught in a CDC light trap indoors. And CDC light traps work better indoors than outdoors. And if we actually have the translation factor for outdoor landing rates as well, we can use that translation factor to calculate the EIR that's based on CDC light traps into HLC-based EIRs. But a lot of times this data isn't present, so we are going to have to make do with CDC light trap catches only. So based on the data you have and your historical data you have, I would adapt the measurements, adapt the calculations, And whenever you're presenting it, mention what you do so people understand the limitations of your data and understand what you did to calculate the EIR. So you might say, I did not have a HLC translation data, so I used just CDC light trap data as a proxy for HLCs, and this is the EIR that was calculated based on this data set. Does that make sense? So you're mentioning what you did and how you calculated things.
Excellent response. Thank you. Well done. Thanks, Neil. Next one, second last one. Let's give two more. Can you please explain why entomological surveillance is considered an important core intervention by WHO?
Great. So it is considered a core intervention because you understand everything about your transmission system from an entomological perspective. And when you understand things, as I went over in a whole bunch of the initial slides, when you understand things, you can make better decisions. And if you make better decisions, you protect people better. So it's a core intervention because, and just to briefly repeat, you understand the drivers of transmission, you understand what interventions are best to put into place, you understand how to evaluate your interventions, you can understand how to optimize your intervention strategies, and you also understand what other interventions you might be able to put in or what you cannot do. You understand where transmission is coming from, you understand how you can protect people, and you understand the gaps in protection that are resulting in your continued transmission. And technically, that's all the data you sort of need to know to understand how to implement vector control interventions best.
Thanks, Neil. Last one. What's your take on the few fixed and findable condition for larval source management, particularly in large endemic countries where ITNs are not really giving the desired impacts? I suppose one can generalize that to, is larval source management a good complement to ITNs where ITNs are not having the desired impact? Over to you. Yeah.
Good question. And this is actually being discussed a lot right now. There are a couple of recent publications on it by Fred Ross Okumu. That's one of them. So there are sort of two questions that the few findable and few FFF, few findable fixed, is few fixed and findable. So that was put out by WHO, but there's another F. Oh, is it F? No, it's a T, treatable. Just because it's few, just because it's fixed, and just because it's findable doesn't mean it's treatable. For example, you can have huge rice fields, and with modern technology, you can treat them, but historically, you may not have been able to treat them. So are they few, fixed, findable, and treatable? That would be a good thing to understand. Uh, as I mentioned in one of the first few presentations, LSM has a different impact on transmission on adult mosquitoes than on infectious mosquitoes than adult interventions. So understanding that prior to implementing an intervention is important because you want to factor in how your intervention impacts all transmission, your larvae and your adults, and what are the gaps in protection with that, as well as how it protects people. I hope that made sense.
Excellent. So, Neil, again, from all of us, wonderful, a total masterclass presentation by a maestro. So, well done. Really a great presentation. We still have day 2 and day 3 to look forward to. You had a very attentive audience today. I'm sure it's going to carry over into day 2 and 3. To our audience, again, for your participation, for your persistence to sit through a particularly long session today. We're grateful for that. Tomorrow won't take as long. We're not going to have survey questionnaires or anything like that. So we're going to dive straight into Neil's instruction. So it will be uninterrupted lessons from Neil tomorrow. So see you tomorrow. Hope to see all of you again tomorrow. Thank you to Dr. Porn. Thank you to Wulan for your technical backstop for this course. And Dr. Mukhtar, our chair for the Vector Control Working Group, will introduce tomorrow's session. We have that to look forward to. So Neil, again, thank you. Thank you, everyone. Have a great day. See you tomorrow. Thank you.
See you tomorrow, everyone.